For our muscle final project, we will be doing a hand clapping push-up.
Muscles that are used in the starting position are transverse abdominis muscle, gluteus medius, gluteus minimus, the adductor muscles of the hips, internal and external obliques, trapezius rhomboids, the anterior, medial, and posterior deltoid muscles, pectorals, ceteris anterior, gluteus maximus, quadriceps, and gastrocnemius. Body position is feet are in dorsiflexion, arms are in pronated and in flexion, legs are in a neutral position, head and neck stays in neutral position, and hands are in flexion.
The transverse abdominis' origin is the lower 6 ribs and the anterior to iliac crest. The insertion point is the pubic crest and the pecten of the pubis. Its action compresses the abdomen. The gluteus medius' origin is the external surface of the ilium, posterior and anterior to gluteal line. Its insertion point is the greater trochanter of the femur. Its action abducts the femur, medially rotates the thigh. The gluteus minimus, its external surface of the ilium between the anterior and inferior gluteal lines, is its origin. The greater trochanter of the femur is its insertion, and it abducts the femur and medially rotates the thigh as well. The adductor longus is the next OIA. Its origin is the medial portion of the superior pubic ramus. Its insertion point is the femur, and it adducts, flexes, and medially rotates the femur. The last OIA is the gastrocnemius. Its origin is the femur medial head above the medial femoral condyle, above the lateral femoral condyle. Its insertion point is dorsum of the calcaneus. Its action flexes the leg and plantar flexes foot.
The muscles used in the down position are pectoralis major, pectoralis minor, deltoid major, deltoid minor, latissimus dorsi, trapezius rhomboids, biceps brachii, triceps brachii, ceteris anterior, quadriceps femoris. The body positions are cranium and cervix stay in a neutral position. Left and right elbows are in flexion. Feet are in flexion as well.
The set of OIAs for the down position are pectoralis minor. Its origin is ribs 3 through 5. Its insertion point is the coracoid process of the scapula. It moves the scapula forward, inward, and downward. The serratus anterior's origin is ribs 108, sometimes 109. The insertion point is the medial border of the scapula on the inside of the scapula, and it draws the scapula forward, and interior fibers rotate the scapula superiorly. Deltoid major's origin is the lateral 1/3 of the clavicle acromion and lower lip of crest of the spine of the scapula. Its insertion point is the deltoid tuberosity of the humerus. It adducts the arm, anterior fibers flex and medially rotate the arm, posterior fibers extend and laterally rotate the arm. Rhomboidus minor has an origin of the inferior end of the ligamentum nuchae and the spines of the vertebrae C7 through T1. Its insertion point is the inside border of the scapula at the root of the spine of the scapula, and it retracts, elevates, and rotates the scapula forward. The transverse abdominis' origin is the lower 6 ribs anterior to iliac crest. The insertion point is the pubic crest pecten of the pubis, and it compresses the abdomen. The gastrocnemius has a origin of the femur medial head above the medial femoral condyle, above the lateral femoral condyle. Its insertion point is the dorsum of the calcaneus, and it flexes the leg and plantar flexes the foot.
Muscles used in an ending position are transverse abdominis, gluteus medius, gluteus minimus, the adductor muscles of the hips, the external and internal obliques, trapezius rhomboids, the anterior, medial, and posterior deltoid muscles, pectoral muscles, ceteris anterior, gluteus maximus, quadriceps, and gastrocnemius, biceps brachii, and triceps brachii. The body position are feet are in dorsiflexion, arms are pronated and flexion, legs are in a neutral position, head and neck stays in a neutral position, and the hands are in flexion.
Our last set of OIAs, which are for the ending position, are the external obliques. Their origin is the lower 8 ribs. The insertion is the pubic crest and tubercle, anterior superior iliac spine, and anterior half of iliac crest, and it flexes and laterally bends the trunk. The internal obliques are originated at anterior second third of the iliac crest, lateral second third of the inguinal ligament. Its insertion is the lower 3 or 4 ribs, linea alba, and the pubic crest. It flexes and laterally bends the trunk. Triceps brachii's origin is the tubercle of the scapula, lateral head, humerus and lateral intermuscular septum, medial head, posterior medial surface of the inferior second half of the humerus. Its insertion is the olecranon process of the ulna, and it extends the forearm. The long head extends and adducts the arm. The last OIA is the biceps brachii. Its origin is the tip of the coracoid process of the scapula, long head, supraglenoid tubercle of the scapula. Its insertion is the tuberosity of the radius, and it flexes the forearm, flexes the arm, long head, and supinates.
Starting it.
Enjoy!
And down.